I love my patients and I love what I do. And that's why the US healthcare system breaks my heart in how it fails my patients. Here are the top 3 ways that the healthcare system takes advantage of my patients, especially around the stressful and frightening time of surgery or in the emergency room. That's number 3. So be sure to stick around to hear about the most expensive and painful part of the healthcare system that you've probably never heard about. Number 1. Big Pharma isn't totally evil, but it sure makes a lot of money off of my patients not knowing the alternatives. Do you know the most prescribed medications in the world? They are for depression, acid reflux, asthma, diabetes, and high blood pressure. And what do all these conditions have in common? They can be heavily influenced by your lifestyle choices, and the prescribed medications can actually influence patients to eat more calories and move less, ultimately leading to weight gain. It's not all medications, but it's enough that it can be a serious problem for my patients. It's in part because patients prescribed medications for lifestyle modifiable diseases like high blood pressure or cholesterol appear more likely to continue those habits even after prescribed medications that contributed to that disease developing in the first place. Sometimes my patients look at me like I'm crazy when I tell them that medications aren't needed for so many conditions like acid reflux, certain allergies, and so much more. And it's often with mind-body techniques that so many of these conditions can be managed, if not fully cured. Seriously, it's like mind over matter medicine. Just look at my other videos or the placebo effect to learn more. I'm not gaslighting any patients. These are real physiological conditions that I had to manage here in the operating room. And I'm not saying every human being on this planet can be cured without the right medications. But natural lifestyle modifications can help reduce the dependence on these costly medications with serious side effects, if not eliminate the need for them altogether. And there's huge money savings, because do you know how much the side effects from our prescription medications cost every year? It's billions and billions and billions of dollars just from the side effects of what we're prescribing. Not to mention the pain and suffering that goes into those side effects when patients end up in the emergency room or urgent care with complications. And in a country where more than 50% of bankruptcies are due in part to medical expenses, this is a huge deal for my patients. And remember, we the people are paying for all those drug advertisements that we see in the United States. And that drug advertising costs us in the tens of billions of dollars every year. Number 2, alternative medicine is a rebranded Big Pharma. Not fully evil, but exploits lots of fears to make lots of money off of my patients. As evil as Big Pharma sounds, it is absolutely life-saving in the right settings, here in the operating room, in the emergency department, or for so many powerful drugs that help patients manage their conditions at home, even if it still comes with lots of side effects. And all the enormous costs and side effects from conventional medicine have fueled this massive interest in the sexier, bigger, better offer called alternative medicine. It markets to the fears and vulnerabilities of so many of my patients who are afraid that they can't get what they need from the conventional Western medical system. And exploiting those fears generates tens of billions of dollars in profits every year for the alternative medicine outlets. This comes from supplement sales, hokey therapy advertising, and consults with these natural doctors, most of whom have probably never been to medical school. Here is the truth about alternative medicine. Many of those therapies probably work and are probably very safe, but the vast majority has simply never been tested to be effective or safe. And until they are tested, they can be really risky. Just look at supplements that are sold as all natural, but are actually just tainted with pharmaceutical medications. Can you guess what the most commonly scammed supplements are and what vulnerable patients they're marketing to? They're in supplements intended for sexual enhancement, muscle gains, and for weight loss. Sound like a vulnerable and exploitable patient population to you? So these marketing pressures from alternative medicine treatments are pushing patients from one extreme of medicine all the way to another extreme of medicine, all while making a buck off of them. And that's because insurance doesn't cover the vast majority of these alternative medicine treatments because they simply haven't been proven, which means that they're out-of-pocket expenses, which can be very lucrative in this market. And number 3, patients paying the most for their medical care are often getting the lowest value of care, often here in the operating room and in the emergency department. Do you know where patients are getting bankrupted most often? Let me give you a hint. Do you know how much 1 minute in the operating room costs? Well, to put things in perspective, that 1 minute can cost more than $100. It's these high acuity environments in medicine, like emergency situations or surgery, that cost the most money by a mile. Cancer chemotherapeutics and biological drugs can also be very expensive as well. But back to the operating room here, because unfortunately, my patients in surgery could be receiving so much more care before and after surgery to make those dollars heal them so much more. And it really hurts me to see those missed opportunities on a daily basis. Some examples: number one, my patients can have worse mental health challenges after surgery, like PTSD and depression. As if recovering from surgery isn't hard enough, having to pile on mental health challenges just makes it that much harder. But that can be prevented and sometimes even reversed with the proper preparation. But my patients simply don't hear about this. Number two, my patients feel victimized when they're here in the operating room or in the emergency room. These can be really scary situations, but it's a slippery slope, and it leads to medicine's biggest secret being covered up. To be clear, I'm not patient blaming. My patients are often in terrible situations with cancer, with dementia, coming in here after a car accident. But when my patients fall into the victim role, they are less likely to recognize the power that they have in these frightening and stressful scenarios. And that empowerment is part of medicine's best kept secret. It's partly because patients are pushed so hard with medications and what we call external loci of control, like tens of billions of dollars being pushed at them to help them think that their control is external to their body. External loci of control. It disempowers my patients and pushes them to believe that their body can't take control over its own healing, like that their body absolutely requires pills and supplements. Sometimes that is true, often it's not. And this is particularly problematic in vulnerable patients like those with cancer or heart disease. In some specific cases, like BRCA genetic testing for breast cancer, it's like highly targeted direct-to-consumer advertising and marketing. Lots of money to be made in a highly vulnerable and exploitable patient population. And number three, surgery and anesthesia frighten many of my patients. Up to 1 in 4 patients may cancel elective surgery out of fear of the general anesthesia alone. And what they're not told is that they actually have incredible control over some of the most common fears, like the fears of complications from the surgery or the anesthesia. Your mindset and preparation before surgery can influence the risk of complications like blood clots, infections, delayed recovery or not being able to get back to work, and so many other complications. And what the system doesn't advertise to my patients, especially not as well as medications, is just how much power my patients can have over these different parts of their surgery experience. And sometimes it can be dramatic power over your experience. It comes from mental, physical, and nutritional preparation before your surgery. It just doesn't sound as sexy as taking a new fancy pill, and that's the point. So many of my patients have an untapped innate healing potential that can help them through the challenges and stresses of surgery. But as you can tell from all the advertising dollars I'm getting for talking about this, it's not much of a match against big pharma or alternative medicine pill pushing. So while big pharma and alternative medicine are so powerful in delivering quality care in the right setting, they just leave so much on the table and straight up disempower my patients, sometimes in the most frightening moments of their lives. That's when they need the most empowerment, not the most medical expenses.